Hi, Angela Ray here with Urban Living. I'm really excited to talk to someone who's a dear friend of mine, who's in the healthcare profession, and I think that talking to her will make a lot of us feel a little bit better about what's going on. There's a lot out there. There's a lot I trust. There's a lot I don't trust. Again, I always send you guys to the website cdc.gov. Even there, I was a little bit disappointed in reading that they had taken down some of the language, accurate language, in trying to appease the Trump administration. So I'm a little bit disappointed in that, but that's still, for me, cdc.gov is the best place to go for information. Certainly the press conferences that are being held at the White House with people who are a part of this, the solution, medical professionals, that's fine. Hearing from the president, I don't really care about that. So let's get into talking to someone who, wow, she has been a part of the medical community for 20 plus years. She is CEO of Foremost Family Health Centers in Dallas, Texas. She is an amazing woman. She's a mother of two, and she is, quite frankly, a mentor of mine, someone who has been a CEO for many, many years, for decades. Joyce Tapley is joining us now, the beautiful Joyce Tapley. Joyce, is so good to talk to you always. Well, really good to talk to you on the podcast. This is the first time that we're talking to someone like this, so it's a really good feeling for Urban Living to get it started with you. How are you doing today?
I'm doing fine, Angela. Thank you so much. I am excited about being on your podcast because I know that we've known each other for quite some time. But I think what's more important is that we reach out to each other on a regular basis to kind of see what's happening in every city, in every state. And
absolutely,
I can tell you, with what's going on there in Washington, which is where I went to school, I'm happy that they are at the forefront of trying to get this disease under control.
And you know, the University of Washington, they've had donations from Bezos and Microsoft and other places to try and help, come up with a solution. So yes, Washington State, we were the first, but certainly we are starting to see things getting a lot better. What's going on in Texas now? Because at this point, we all know the narrative that African Americans are dying in untold numbers. And Joyce, before you talk to me about Dallas, I just wanted to go ahead and just quote a couple of facts here. Michigan has a black population of 14%, but 33% of the coronavirus cases are black. And 41% of the deaths are us, blacks. Yes. Chicago, black population of 23%. 58% of the COVID deaths are us, African Americans. Milwaukee, blacks are 1/4 of the population, but half of the COVID-19 cases. Louisiana, 7 out of 10 COVID victims have been black. Joyce, this is disturbing. It's disturbing because once this information came out, black people began to feel like, wait a minute, we've been here before. We've been here before where we feel that the government has done something to our community, used our community as a petri dish. There's a lot of just overall mistrust toward the federal government with respect to this. Are you finding the same thing in Texas?
We are. And Texas is, as you know, even before this took place, in terms of healthcare, we've usually shown up to be at the bottom of statistics in terms of the number of blacks and the number of poor who did not get access to health care. So we're ranking low still. And so what we're seeing across the country now with how this new virus has affected blacks, it's very similar to what's been going on for well over 50 years, which is one of the reasons why community health centers like ours that are predominantly based in underserved areas, predominantly black and Hispanic areas and underserved populations, we have been designed to run comprehensive primary care and preventive facilities in the areas to provide access. And we are collectively throughout the entire country, all of the community health centers who are partially funded by the Department of Health and Human Services, we're doing a lot to try to improve the quality of care and the access to health care for everyone, particularly those who are uninsured or underserved. And that's a lot of Blacks and Hispanics and others. And it is terrible to see this happening again.
Again, it is terrible. It is heartbreaking. But you know what? We're not going to let this happen. I mean, we have, now that the information is out there, Joyce, I just feel helpless. You know, I just feel helpless. Like, what can we do? And you know, as people were expiring, I think that they started looking at, okay, what is causing, what could exacerbate this? And obviously we talk about other underlying conditions that someone might have. And we know that in our community, in the African American community, we have not had access to adequate food, to adequate health care, and on and on and on. And all those things have led to massive problems within our community when it comes to health. And this is not just with the poor. This is middle class, this is upper middle class, and upper class Blacks are dying.
That is correct. And let me just say this. I'm gonna start with saying this. This is a perfect opportunity in terms of what can we do? We have to advocate. We have to be advocates for the Black community and for anybody who does not have access to healthcare, who is in an area where they they don't have enough access to healthy foods. Like we said, there's not a lot of grocery stores in most of these areas that are underserved.
Food deserts. That's right.
Yeah, a lot of food deserts. But and part of the advocacy starts with getting out to vote. There's a census that's going around this week.
Thank you, Joyce.
Every person in a household that gets that letter or that email, however it comes, needs to fill that out.
Thank you, Joyce. You hit the right note. Yes.
And vote.
The census. Go.
Census,
talk.
And as well as voting. That not just for the presidency, but for every primary election, because those are the people that are going to work on our behalf to make sure there's additional funding when it comes to health care or anything else, school, education, jobs, and all of that. We have to select the people that are going to represent us at the local level. And until we do that, there's not going to be a lot of change, but it takes everybody who is an eligible voter, even if they are not registered, they need to register to vote every other year that we have an election, local as well as state.
Awesome.
And everything. That right there is the start. Go ahead.
I love that you mentioned the census, because people, you have received information from the federal government about the census. You need to fill it out. I'm talking to Black people, Hispanic people, white people, Asian people, my native people. We need to all fill out the census, because everyone does. This determines how we are able to get funding. You know, if 10,000 people who are Black don't fill out the census, that's going to impact the resources that we can get for that community. So Joyce Tapley has hit a note that my friend Elsa is going to be so excited to hear. Fill out that census, and by golly, go and vote. There were too many people who marched, who were hurt, who got hung, who were killed, who were tortured and murdered. Yes. Come on, girl. Yes. So we could have the right to vote. And it hurts me to the core when I don't see enough of us getting out to vote. Tell you what, though, I think we're highly motivated this year to get out to vote. I think we're highly motivated. And I'm going to say this, and then I'm going to get back to what we're talking about. And if you're sorry and if you feel badly because Bernie Sanders didn't make it and you're not going to vote, you're doing the wrong thing. We got to get this guy out of the White House, get Joe Biden in, and we'll take it from there. Now, I'll pull back from my politics and I'll get back to our healthcare situation. Again, Joyce, you know, these underlying conditions that seem to really bedevil Blacks. In particular, this is one of the leading reasons why we're not able to survive this virus.
Yes, so there's a couple things. One, even if you don't have any health issues, there are still people ending up in the hospital on ventilators, either making it or not making it. So this virus affects everybody. And we know if the families would share what their health conditions are, then we know what our risk is for getting them. I have cancer in my family, diabetes, heart disease, asthma, all of that runs in our family. But we know that enough to know to go to the doctor. Now, one of the things I want to say is every community throughout the country, pretty much every community, there are well over 2,000 community-based health centers that are comprehensive, primary care, preventive. They focus on chronic disease management. If you have it, if you don't have any conditions, then you at least know that and you can still continue with your life. They offer dental services. So all of these types of community-based health centers that are partially funded by the government are available in communities. If everyone that does not have a primary care provider would go and just Google community health center or federally qualified health center in your area, then you can know there's a place that you can go to get comprehensive care for your entire family. And most of them are established to where you can just go to one site or two sites to get all the services you need to keep you from going into the emergency room. So that's one thing. Then the second thing, just in the state of Texas, we are seeing people, now our numbers are not as bad as some of the other states. However, there are still people walking around thinking it's not going to happen to them. And that's everybody. So what we need to do is, if they have an ordinance like we have one in every county now, then protect yourselves and protect your family by either masking or staying home and just being in an area where you can do things to still stay active, but to really try to keep this disease from spreading. We have been fortunate at our health center to only have one person test positive for the virus. However, the staff members are still at the front lines being exposed to potential illnesses and viruses. And so for us as a community health center, we're doing a lot more telemedicine, where we can actually talk to the patient on the phone or through an iPad or iPod or laptop and provide that primary care service for them, with the exception of actually checking their blood pressure. But we're moving into that direction as well. So there's going to be a lot more technology that will allow our doctors and hopefully one day dentists to be able to provide services externally so that our patients don't have to come in. But for right now, Go ahead.
Well, no, I was just going to say, you've made some really good points, and I this week on Monday I had a phone conversation with my primary care. She actually wanted me to use Zoom or to use MyChart, and I let them know that, look, I'm very uncomfortable with my medical information being online, that my medical information was already hacked, UW Medicine, and I am madder than a wet hen about that. So I'm very uncomfortable, just, I don't like to think that my medical information is on the screen as I'm talking to a doctor. I just we had a phone conversation, and as you said, there's going to be new stuff coming out, new ways of interacting with patients, and I know that I'm excited about that and looking forward to that, because you know what, Joyce, we're in a new normal. We don't even know what that is yet. But I love that what you're saying is the federally qualified health centers, you guys are moving in tandem, to try and help get the services to the people that you serve who need it. And by the way, let me just say this to my folks out there who are listening. I love a federally qualified health center because I like to know that I can go to one place and get everything done. When I was lived somewhere else, I was part of a federally qualified health center. Love all the doctors. It's great care. I don't want anybody thinking, how some people think, well, it's for poor people. So no, it's not.
No,
it's for all of us. No, it's for anyone. And you know what?
Right.
There is nothing more satisfying than being around some of everyone. Some of all different types of socioeconomic backgrounds. Some of us try to avoid that. I don't. I thoroughly enjoy my experience whether it's in the waiting room or with the doctor. So, think about supporting federally qualified health centers. Like Joyce said, you can do some research to find out which ones are in your area, but I would highly recommend it. Joyce, I wanted to check to see if your staff has received all of the personal protective gear that they need to feel comfortable to do their job.
Right now, we can last probably a good week or two. However, if it gets to where people are getting sicker, whether it's the coronavirus or anything else, we have to gown up. And every person that does that, then that means we have to order more equipment. So we do have the PPE for right now, but it's not going to last that long. I think what's more important is any way that we can have the community and encourage people that are out there to start paying attention to any kind of conditions that they have or any kind of symptoms that they have. And depending upon what it is, contact a primary care provider first. Tell them the symptoms and let the provider let them know what they should do. And if they believe that they have some type of virus or illness, go and get tested. Because the bottom line is we have to stay healthy. And if a person walks around with that virus and carries it to somebody else, it's going to continue to spread. If you don't have a PCP, you need to find one. And hopefully there's one near you, because it's all about trying to make sure that you are healthy and keeping yourself in the right frame of mind from head to toe. This is not just your medical body, but it's also your mind. It's also the way you live mentally is what's important as well.
And I'm glad you mentioned the mental health component, because I have been working from home. This is probably the 5th week, and I communicate when I can with my compadres at work. I miss them a lot, and just the mental health. I worry about the mental health of my buddies who their kids are at home now, and they still have to work, and the kids are like, Mom, Dad. So as well as the mental health of the children who are they're missing their interactions. Yes, and they're stuck at home, and the interactions that they had at school and the way that they were able to get their wiggles out, or get some of that energy out of the way. They're not at school now. So the new norm is Mom and Dad have to be teachers. Right. Lord help me. And in addition to cooking the meals and doing your job so you can keep money in the house.
That's right. Oh. It is a lot. And I can tell you right now, I was going to a studio to try to work out, because I found that I have a heart condition that I have to really do a lot more exercise than I thought I had to do. But I'm not doing that now, so I'm going out roller skating. That's
awesome.
You have to be flexible and creative. I'm roller skating. That's what I can do to get my heart rate up while my daughter is running and she's doing stuff with related to gymnastics. But I can roller skate. I'll get out there and do my thing and hope that I don't fall. But I think the bottom line is mentally, that is very, very refreshing. And I had never thought about that until now.
But that's great, Joyce, and thank you for talking about this, because ever since I've moved out here, I've had some issues with knees and haven't been able, I love to work out the way I want to, but really, if you are not someone who is used to, working out, just do some physical activity. Just, even if it's, I'm looking at my backyard, even if it's the backyard, just walk around the backyard if you don't feel safe, venturing much further. Do something to get some exercise. There are a lot of options online. I basically work out at home. So there's no excuse. And Joyce's point and my point, exercising is so good for your mental and physical health, but people don't oftentimes realize how it really impacts you mentally. It gives you so much confidence, and it gives you so much energy, and it really is good for your body. So think about doing this while, we are in this very unprecedented point in our history of the world. So think about doing for you, because what Joyce and I are talking about is self-care. And self-care is so important. And these parents who are at home now, and these kids are just getting on them, it's harder and harder for them to find a moment of self-care. Right. you need to tell those kids, Auntie A said, go sit in the corner. Mama's about to do some self-care, and if you say the word mama once, it's going to be on like Donkey Kong. I'm trying to help my friends out. These kids are something else. Boy. So tell me, you said that the health care facility is still open. How are you handling, I know that the governor wants social distancing there in Texas as well. How are you handling that and still being open?
Well, I can tell you one thing. Well, first of all, we closed today so that we could have a deep cleaning of the facility. So we gave the folks an extra day off, and that kind of gave them a little relief. But in terms of social distancing, we have decided that half of our providers would stay home and do telemedicine on certain days, and the other half would be on site. So we limit the amount of people that are in the building. But again, we're trying to be as flexible and creative as we can. And the more patients, most of our patients need prescriptions, refills. Mm-hmm. So our doctors can do everything remotely and help them with that. And for those who are really sick, we work with them and bring them in. But that's one of the ways we've been able to decrease the social distancing. But I wanted to ask go ahead.
Yes. No.
I was gonna change the subject for a moment, because our doctors are talking about this with our patients. But I think worldwide, because we don't have the data that we need to understand how these folks that do have the virus, what kind of conditions they actually have, they talk about people having multiple conditions or chronic conditions, but they don't say specifically what all is going on with the folks. And I think that it would be more helpful in data-wise is if they talk about whether or not the people have asthma, heart conditions, COPD, whatever it is that they have, so that our folks who have not been affected right now by the virus, if they have those conditions, they can understand just how much it can impact them if they're exposed, with hopes that they will be able to start really exercising the ordinances and really staying safe and putting the mask on, using gloves if you have to, and keeping the distance the way they need to. That's one of the things we really need to do as well.
That's great. Are you seeing, are you feeling like the people there in Dallas and it's a very big city, are following the rules, are playing by the rules?
I think that they're doing a lot more of that now. In the last 2 or 3 weeks, yes, it's changed. I mean, even when I have to go into the office, which is not that often, I go in for a little bit, but I'm not on the front lines like our staff members. But there's not nearly as many cars on the road. And there's a lot more people walking and riding their bicycles and doing other things outside, which is actually good, because folks do need to try to do things that help them be active. But I think what's more tragic is there's so many people, so many businesses that have closed, which means most of those folks do not have a job. The businesses are trying to apply for the loans that are available, and even if they have applied, like we have, the money is not available yet. It hasn't come to the businesses to help those who have been impacted, whether they've been furloughed or laid off. Yeah.
And the federal government has, they've earmarked, I think, about $350 million of that stimulus package to small businesses in loans and in grants. But they rolled it out so quickly because things are happening so quickly, and banks did not have enough time to absorb the information. Right. And as a result, the grants that people so desperately need, these small businesses, I think only one bank was up and running out of the gazillions of banks. Wow. So, I certainly understand. This is my past as a business and law, but I certainly do understand the need to understand what is being asked of banks. They need to feel comfortable with what they're doing. Yes. And so that may take just a little bit longer than we thought, but I just really feel like we just need the federal government to be just really honest with us about timelines and expectations. And when you're hearing one thing from the health professionals rather, and then you're hearing something else from the politicians, I'm going to go listen to the health professionals. I don't need to listen to a politician. You don't know anything about medicine. Bye-bye.
Yes.
Healthcare.
Well,
something I wanted to.
In Dallas and in the state, because we canceled the South by Southwest. We were one of the first places to cancel anything that was major, and so when they did that, I said, "Oh, this has to be serious." And then
well, what was happening is that people were dropping out of South by Southwest.
That is true.
Big people. And so South by Southwest ended up saying, we've got to cancel. I mean, look, one of the things that I serve on the special events committee here in Seattle, and we've just had to. I mean, we're in a conundrum, because we have. I think the governor has given us May 4th. That's a new milestone, a new benchmark there. And then, we have all these events that happen, major events, that bring a lot of money into the city, that happen in the summer months, and we don't know. That's the whole thing is we don't know. There's so much we don't know, Joyce, that when something gets in my head, like I started thinking the other day about, well, I don't know what to do about shoes. And then the next day I woke up and there was an article about it. So, I just think for me, any kind of worry that I have, I'm like, you know what, Angela, just spray it down with the little bleach stuff that Peter came up with, and that makes me feel a lot better. I'm wiping down constantly. Yeah. I do live with two elders. They are very healthy, probably healthier than me, and and that's been a really great thing to actually be sharing this space at this time with them. They look out for us and we look out for them, so that's worked out. I want to mention something to you, Joyce, that just really has angered me, and this is just straight up racism. So this is in Baltimore. A white cop was walking through a public housing complex, and a woman said something like, there's the officer. She said some stuff, and she had some profanity in there. So the man walked by her and some other people that she was sitting with and coughed 10 times without covering his mouth. And so disgusting. That's crazy. That's disgusting, and it's crazy. Mm-hmm. So the video got out, and now he's in a boatload of trouble because they want to also look at the body cam. But again, this brings up a racial component that is simmering somewhere within all of this, because you can't deny the statistics. And although the Centers for Disease Control and Prevention does not look at statistics by race, they can still tell through state data and city data the same thing, that African Americans are being wiped out. And, when you hear figures like we may have 100,000, we may have between 100,000 and 240,000 deaths, and the majority of what we're seeing is that as African Americans, it is extremely concerning. Now, let me say this. The coronavirus, and you correct me if I'm wrong, Joyce, it has not, as of yet, really gotten into the rural portions, a word I can't really say, rural portions of our country. It's been mostly in larger cities, urban environments. So, but it is heading to these smaller communities that thought that they would be safe. So I do have some concern about these smaller communities as well, and the fact that something as deadly as this could be very impactful.
That's right.
Yes.
To wipe out the city.
Don't want to say it, but yes. It is true, right, Joyce?
I would think it would be, given how it has spread. Well, in urban areas, people are around each other a lot more. But yes,
exactly,
if you have one
exactly.
or two or three in a particular area.
Yep.
Then yes, I would imagine that it could wipe out that area. So I would hope that the government is able to produce many more, many millions of the tests, so there will be more available in every area throughout the country. Plus these new types of tests that they're detecting to see if there are antibodies. That would be a good way to determine whether or not somebody has already been exposed to the virus and maybe not had any symptoms, but they at least know they've been exposed and then their body is building up more antibodies for their immune system.
What do you think about this anti-malarial drug that Donald Trump has some stock in?
Because I'm not, look,
okay.
that right there, if it didn't come from the doctors, I'm not.
Yep.
I don't have too much thought about that, because I'm relying on the experts who are the scientists.
Thank you.
And,
Yep.
and the researchers and all
And,
of that. So
and I do want to point out that Donald Trump does have stock in the anti-malarial drug that he keeps promoting. So that's disturbing in and of itself. So now we have, now we know a little bit more even. So it's just highly disturbing. So listen to what Joyce Tapley is saying. We are waiting for a vaccine. In the meantime, there are a lot of things being tested. Do not listen to President Trump talking about the anti-malarial drug. Oh, just take, no. You don't know the side effects. Who are you, the FDA? No, you're not, Mr. Trump. So let's take Joyce's advice here, and let's be really, really fastidious and cautious about where we're getting our information from. Again, Joyce, I like to send people, you heard me at the top, to cdc.gov. If you know of an, okay, good, perfect.
That is where I go, the CDC, because that's where we have always gone. There should be nothing different at this point, other than they have a lot more researchers and scientists and specialists and experts to continue to provide the information that we need, and that's where I go. So,
Joyce, can I ask you something? What can we do to help you, to help health professionals, to help those on the front lines? What can I do? What can my viewers? What can those people who are watching you and me today tell us?
I'm going to say it again. First, fill out that census. Make sure you're registered to vote so when it's time to vote. But also take care of yourself, because by doing that, then we're improving our chances of having a longer life for ourselves and our family members. So if you don't have a primary care provider, whether you have insurance or not, or have money or don't have any money, or are limited, those community health centers are designed to take care of people whether you have any payment or not. We are there to try to alleviate any problems, health problems. And we, like I said, we do things from head to toe. We provide services, mental health, podiatry, from head to toe, literally, including dentistry.
Wow.
So we really do everything. But I think that at this point, when people feel like they are fine and healthy, it still is good to go and see the doctor and get an annual checkup. It's still good to go to the dentist twice a year, if you can. Whether you can afford it or not, the goal is to try to keep you from getting sick and showing up in that emergency room and then having more problems. And it's difficult for us to do that sometimes. But if any of us have children, then of course we want to be around as long as we can to see our children grow up to do the things that they want to do. So it still starts
absolutely
with us. It still starts with us and taking care of ourselves, thinking positively. I mean, we have Easter for those who celebrate Easter on Sunday. This is Good Friday, and this is a time, just like most weekends, this is a time for us to really relax. Hopefully, enjoy what we can see, if we can see, because some of us can't. But enjoy what's around us and be thankful for the things that we have. But for us, advocating on behalf of health centers and hospitals and doctors' offices, doing that would be great. Staying inside and following the ordinances would be extra great, because that will prevent the spread of that disease.
Thank you. Joyce Tapley, you not only talked to us about COVID-19 and what we need to do there, you also hit two very, very large themes, which is Census 2020 and the need to get that filled out and filled out accurately as soon as possible, and the need for all of us to vote. When I turned 18 years old, my father asked me, what did I want? I said, drive me down to go and register to vote. That is what we need to do, because if you want someone to truly represent your interests, we're going to have to get out there en masse to make it happen. Joyce Tapley, CEO of Foremost Family Health Centers in Dallas, Texas. We thank you so much. I want you to know that Urban Living with Angela Ray, that would be me, will be checking in with you often just to see how you're doing, how the rollerblading is going, and to also just, get more information from you as you are talking to your buddies and just learning more. You are a fountain of information, and you are at the top of your game in your profession. So we are very fortunate to have you. And it is very important for me on Urban Living that we talk to as many people of color, in particular women, because that's important to me, that I uplift women, and in particular women of color. So email me at Angela Ray, RAE.com, just for any reason. And thank Joyce, because she's awesome. Awesome sauce, Joyce Tapley. We really do appreciate everything that you've said to us. We're going to take all of your advice to heart and ask you to stay safe. Have a wonderful weekend. And I can't roller skate, but I can rollerblade ish. So you go you go have a good weekend, and thank you so much, my friend, for talking to us.
All right, thank you for letting me be on your show. I appreciate it.
Okay. Thank you, Joyce. Bye-bye.
Take care. Bye.